exit of the year 2023, it is a good time to look at the current state of Nigeria's health sector. Hello and welcome to Health Options, the program that not only tracks government policies on health, but helps you with the information you need to make informed choices about your health. Thanks for joining us on the program, the very first in the brand new year 2024. I am Rabi Abdullah. The retrospective review of 2023 on health options will not only acknowledge the progress made, but highlight Nigeria's continued journey towards a better and more robust healthcare sector. Nigeria continues to experience poor health outcomes, such as high maternal death rates and poorly functioning primary healthcare (PHC) facilities. Let's now join the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Muyi Aina, as we beam our searchlight on child and maternal health, as well as disease control.
70% of the problems that face Nigerians in terms of healthcare can be addressed if we have a functioning and effective primary healthcare system. We have had challenges along the road. Different people, different administrations have come and put in, their best. Now, the Basic Healthcare Provision Fund is a funding mechanism that really gives us an opportunity to implement the National Health Act of 2014 fully, if done well. The Honorable Coordinating Minister of Health has articulated an agenda for the health sector that is really hinged around 4 pillars, which includes governance, qualities of services and outcomes, things around health security, but also value creation, value chain in healthcare. And a lot of the service delivery and health access component fall on the NPHCD, of course, working with our sister agency, the NHI, National Health Insurance Authority. We have been taking a thorough look at the Basic Healthcare Provision Fund and how it's been implemented so far. And there has been a substantial amount of progress. The initial focus was to even, first of all, build a pipeline, create a mechanism to be able to directly fund health facilities in the front line in a way that they have the resources for their operations, to get the commodities that they need, maybe even hire ad hoc workers, do some facility improvements that they need to be able to provide services to people. And that's working well. As of today, we have upwards of 8,300 health facilities, PHCs, across the country that are directly funded by the BHCPF program. We are now at the point where we're looking at that and saying that's no longer enough. Getting the funding to the front is not enough. What are we actually doing? What are we buying with these resources? So we want to start focusing on outcomes right now. And the objective of this government is really for the primary healthcare system to guarantee every Nigerian, wherever they live, access to high quality basic healthcare services that they need at a price they can afford, that is not harmful to them, which is free to low cost. That's really what that means. And what does that really mean? It's how do we support our PHC primary, one at a time, a few at a time, to become fully functional, meaning at any point in time when you walk into these facilities, you can access services. If you're a pregnant woman, you can walk in at any hour of the day or night to be attended to, either to get antenatal care or to deliver your baby, or even to be admitted for postnatal care and get care for your newborns and young children as well. Responsibility for hiring and deploying health workers in the front lines lies with the states, but many states are struggling. Some are not resourced enough at this point. Many, even with the resources, cannot find the health workers that they need because they're working within the confines of the state. So as a National Primary Healthcare Agency, we have a number of programs where we're providing temporary relief in terms of recruiting and deploying health workers to support them. Where we have challenges getting certain tiers, we're working on some task shifting mechanisms. We're bringing in, redundant, health workers, either those that are not employed, that have either been volunteered or not even practicing, or those that are retired in some states, really supporting them to come and do some more work and give some more useful service and fill the gap. Now, for the medium to longer term solution, the Honorable Minister is overseeing an entire human resources for health strategy that is multifaceted, that is really looking at, okay, what do we need and how do we get what we need? Working with training institutions to expand training capacity, working with licensing and regulatory authorities to review and update, what is required to deliver services, working with our partners to mobilize the resources, to pay and incentivize many of these workers to work in rural areas. Because, again, the problems that we have, the Japa syndrome, yes, it's one of them, but even the health workers that we have are not optimized. They are not evenly distributed because the incentives to work in rural areas are not the same as they are to work in urban areas. So it's really looking holistically at all of that and saying, look, how can you address each of the discontinuity or barriers to solve this problem more broadly. One of the other interventions that is immediate and will see the impact in short order is the training of health workers that the minister has announced. The minister has initiated an intervention to train 120,000 frontline health workers, over the next year or so. And that is kicked off already. We are right now preparing for the initial national training of trainers. The curriculums have been revamped and updated, to reflect the realities of now, but also to make them appropriate for the different cadres of health workers that we have in the front lines. The idea is to identify people who are actually working in the front line, not just people who are nominal, who bear the title head workers. And then we're working with the states through the Governors Forum to identify them so that they can be employed by the states. We will train them, upskill them so that they are better able to provide health quality services.
The upsurge of diphtheria tested the country's health security capabilities, exposing gaps and highlighting the need for improved health security measures in the country.
So one of the areas that the primary health care system in Nigeria has historically been challenged, has not done as well as we would have hoped to do to meet the expectations of Nigerians, is in the area of routine immunization coverage. So outbreaks occur because populations are not immunized or vaccinated against diseases. So the diphtheria outbreak occurred largely because we had large pockets of low population immunity in several states, and frankly the outbreaks just mimicked if you look at the data, which were, we've sort of looked into it, the outbreaks really mimicked the spread or the distribution of low population immunity across the country. So when you have an outbreak, the responsible thing to do is to respond. So what we have done, the National Primary Health Care Development Agency, working with NCDC, working with many of our partners under the leadership of the Coordinating Minister for Health and Social Welfare, mounted an outbreak response. And we have now done 3 rounds of campaigns using the pentavalent vaccine that includes the antigens for diphtheria and also tetanus, toxoid TD, in 62 local governments in all. Some of the local governments, because we were adding them as the outbreak was expanding, so some of the local governments, I believe about 33, have done 3 rounds. Some subset has done 2 rounds, and a few, about 6 or so, have only had 1 round. So because to be fully immunized against diphtheria, a child needs to be vaccinated 3 times. So basically, what we then do is we do 3 rounds of outbreak campaigns using the TD vaccine and the pentavalent vaccine. Yes. So in addition to that, What we're also doing is, of course, treating people that are affected. You have to use the antitoxin and sourcing for it, and really building the capacity and supporting the states to be able to provide treatment for those that are affected. The minister set up an emergency task team that is chaired by myself and co-chaired by the DG of NCDC, and we sit multiple times a week, 3-4 times a week, to review the progress, track the trends and cases, and adjust the response as necessary. And I can tell you that we're not where we need to be yet, but the cases have started to dwindle across board. Kano and Yobe were the epicenters, and at the peak of the epidemic, we were recording upwards of 2,000-3,000 cases a day. But as at the last data that I saw, it's not even 100 across all of the different locations. So I think it's not over. In fact, it's been somewhat of a protracted outbreak response, but it's better now. Now, to sustain the effect, we're going to have to really strengthen the routine immunization program, and that is a core pillar of the agenda of the primary healthcare system going forward. We're really going to be looking at, not just in those states and not just against diphtheria, but what are those systemic issues that make it difficult for our people to get access to the life-saving vaccines that they need for our children especially, but also for women and adults. So yes, we will be doing a lot of that with our partners.
That's the name in Hausa.
That is call it Ose.
In Yoruba.
Ose, Igi Ose.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density lipoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
Cervical cancer is the third most common cancer among Nigerian women, and the human papillomavirus HPV vaccine is highly efficacious in preventing infection with HPV types 16 and 18, known to cause at least 70% of cervical cancers. On the 24th of October 2023, Nigeria introduced the HPV vaccine into the routine immunization program.
Vaccines are the most cost-effective health intervention that have been invented to date, and they are very important. And to the extent that is possible, the government of President Bola Ahmed Tinubu is working to add those vaccines to the routine program that are necessary to protect the lives of our people and prevent the diseases that are killing our women and children. The launch was greeted with a lot of excitement. We had traditionally, it was launched by the First Lady herself, Chief Oluremi Tinubu, which is really a testament to the high level of political will and interest at the highest level, given the prioritization that the President has given to health. We had other leading traditional leaders led by the Sultan, His Eminence the Sultan of Sokoto, amongst others. We had religious leaders, we had top opinion leaders, which was good because, I can tell you that fortunately, even though we did have some initial pushback, as you will expect, with some negative campaign and anti-vaxxers, we've recorded what I would call a resounding success. In the first phase states, which are 14 states and the FCT, we have vaccinated 4.7 million girls as of now, which surpasses the target that we set for this period, which means we have all of these young ladies are now protected from the risk of future cancer, cervical cancer. And what happens is that that's one less problem for them to worry about, and that's excellent. We will be expanding to the remaining 22 states around the middle of next year, May of next year. but at the same time we are routinizing the vaccination in the existing states, meaning that we are making it now available at the facilities, both private and public, and people can just go and get it routinely. It's not gone without its challenges, as I'm sure you are aware. We did have a few people come out to develop and disseminate ill-informed messages that were campaigning, trying to discourage people from the human papillomavirus vaccine and linking it to effects and causes and intents that were not necessarily so. But because we are aware that there is no parent or guardian that, armed with the right information, will make choices that will harm their ward or children, we countered that the way we normally do, partnering with you all in the media, with our advocacy partners, some of our development partners. We really went out to engage and disseminate the correct information that is evidence-based to the public. I think, this is where the partnership with you, media, remains very important. I think very quickly we were able to drown out the voice of the naysayers, and thanks to you all. So looking forward to doing more of that together.
While the success of the vaccine rollout in the pilot states and the challenges that still need to be addressed to achieve the national target for HPV vaccination coverage are important lessons, as plans for the second phase of the vaccination introduction is scheduled to start in May 2024 in 21 states. Up next, the views of some members of civil society organizations on expectations.
So for immunization itself, Nigeria made commitments to purchase vaccines, and to introduce new vaccines. Introduction of new vaccines is a laudable one, because truthfully, Nigeria introduced 2 critical vaccines, the rotavirus vaccine and then the HPV vaccine, which is quite laudable. But all these things that we're doing, let us also start to prepare for the fact that we must have a routine way of paying for these vaccines. Because whatever it is, as we're talking about it now, Gavi, who supports us, we have partners who support us in this vaccine procurement. Gavi has said they're leaving in 5 years. 5 years is just around the corner. So we have to start to prepare our mind to routinely pay for these vaccines. So one is to budget for the vaccine. The other one is on-time release of the funds that have been budgeted for. And then the third one is full utilization of whatever it is that has been released. So these are the things, these are the touch points that even you as media all of us are in this together. The government is willing to work with CSOs, we are also willing to work, because at the end of the day, mortality must reduce, and vaccine supports increase in life expectancy.
I think that with the body language of the government, President Tinubu actually appointing capable hands, leading the ministry, the agencies. I think that is laudable, right? That is a step in the right direction. Then we also have a new approach to health. We call it sector-wide approach. I said we because now is the government taking leadership, and they've actually shared it with civil society organizations. We feel that is a beautiful one. They've called us from the planning stage. We are also part of the process. We think that is laudable. I think that is a step in the right direction. It's actually now to break it down in terms of how do we operationalize it. Beyond commitments, how do we ensure, beyond just saying this and writing and budgeting and projecting, how do we show commitment by actually putting structures in place? Because it's about structures. It's about systems that will make things work. That automatically, anybody comes into the system, it works. It does not matter who is in there. Putting systems and structures in place to make sure things work, and then backing it up with money. What can you do without money? Funding for immunization cannot be, we cannot joke with it. So presently, 2023, it was 60 billion earmarked for immunization. It has been increased, right, for 2024. I think that's kudos. How do we ensure that this money is released on time? Because for programming, timely release, if you plan that you want to do programming in January and the money is released in November, it has distorted the whole thing. You cannot achieve whatever you have projected to. So timely release of funds is what we are calling the government to do.
There are certain things that are different in the way President Bola Ahmed Tinubu and his ministers and the agencies are coming at this. I think a lot of work has gone into the health sector, not just the primary health care system. But what's different now is because we are now implementing a sector-wide program for health care, there's better coordination so that all of the resources are synced in a way that, you know, if you're investing in a facility, hitherto, different partners were doing different things and trying their best to contribute, but because it wasn't coordinated, you know, we weren't working in sync and the impact was spread around. So there's going to be better coordination so that if we say a facility is functional, it will have the workforce that it needs. It will have the infrastructure that it needs. It will have the funding that it needs for operations. It will have the commodities that it needs. And it's going to also be linked up with the communities through the community health extension workers and through, you know, other platforms that exist. That's one thing. The second thing is there will be a lot more transparency in the way we are working. We will be open, we will be communicating, you will be able to track where we are. If we say this is the number of facilities we have, we can tell you this is the number that is working 24 hours, we can tell you this is the number that is staffed by skilled birth attendants, we can tell you that's where we are going. So that transparency, that coordination, but also accountability for results. So right from the minister to the agency through to the health facility, the emphasis now is not going to be on how much money has gone into the system or how much of activities have happened or how much of things have been bought. It's going to be how much service delivery is happening, what is the quality of that service delivery, but also how is that then impacting the quality of life of people that are served by that facility in terms of their survival, you know, mortality and survival, but also in terms of their morbidity and reduced illness, you know. So those are some of the things that you can really look forward to, and I think working together, we hope to be able to demonstrate substantial progress going forward.
That's the name in Hausa.
That is call it Ose.
In Yoruba.
Ose, Igi Ose.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density lipoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
That does it on this episode of Health Options. Keep updates with us same time next week as we bring you more on highlights of the nation's health sector in 2023. A quick reminder that you can go to our YouTube channel to watch the upload of this and other episodes of the program. My name is Rabi Abdullah. Be good and stay safe.